Boston's making progress toward recovery from COVID-19, but there's still plenty of work ahead. Almost 42% of the city's residents are at least partially vaccinated, but figures also show there's still a racial gap in access to vaccinations, especially for Latinx residents, along with differences between neighborhoods. Those are some of the reasons for a new vaccination effort and an outreach campaign by the city. To bring us up to date is Boston's Chief of Health and Human Services, Marty Martinez. Thank you very much for being with us, Chief.
Thanks for having me, Chris. Appreciate it.
Yeah, I want to start with what I'm seeing just today, looking at the Healthy Boston feed on Twitter. All of these places where you can walk in with little waiting, just come in and get your shot. That looks like it's really good news.
Yeah, absolutely. I mean, well, what we're trying to do is make sure that we're breaking down any barriers for people to get access. So sometimes we might have a last-minute clinic, a pop-up clinic we're able to put together. So we put it together, and if we have available appointments, we let people know. So again, we're eager to make sure people can get access. And we know starting next week, we'll have full open access for everyone who's over the age of 16 for Pfizer and 18 for Moderna. And we want to make sure that when people are ready, they can get in. So that's part of our goal.
Now, nationwide, we've also heard some troubling news about the Johnson & Johnson vaccine. That's still being looked at more closely. What does that mean for Boston?
Yeah, I mean, the J&J vaccine, obviously the federal government provided, decided to go and pause the use of the vaccine nationwide. And of course, the state and the city is following that guidance and that recommendation. So we're pausing it. In the city of Boston, I think only about less than 3% of Bostonians who've been vaccinated have been vaccinated with J&J. But this pause is just out of the abundance of caution, right? About 6 people out of 7 million shots have developed this blood clot disorder, very rare. And the CDC and the FDA are doing what they should do, which is pause the vaccine, make sure that they can truly understand what this is, and then make sure that when it's ready and it's safe to continue it, that we can continue with it. So right now in the city, we haven't used it a lot yet. The big benefit of it, obviously, it's 1 dose. Which means you can get in and then you're done, which is a really important tool to use. So we're hoping that it checks out and everything is good to go, so we can continue to utilize it. But we're following that guidance right now and pausing it.
It wasn't so long ago when many of us were struggling with the state website and having to pick from a small number of locations, not necessarily convenient either. But nowadays, you have the city taking the vaccines to people where they are. What does that mean exactly?
Yeah, absolutely. I mean, for us, we want to break down those barriers. So we've created some mobile vaccination clinics that allow us to pop up a clinic one day and get people vaccinated. So as we speak, folks are at White Stadium getting vaccinated today. Probably close to 700 people will get vaccinated there. This weekend, we'll do a pop-up clinic in the Austin neighborhood to get people vaccinated there. And we have in the past several weeks gone to community-based organizations, faith-based organizations, parts of the Boston Housing Authority developments. So it's really important that we have all of these strategies, the big mass sites like Fenway and Gillette and Reggie, and then these smaller sites, these mobile sites that bring vaccine to folks. So we're going to need all of those strategies to get people vaccinated, and these have been an important tool that we're using on the ground.
I want to ask you about the gaps in access here, and some of them are dictated by policies about age groups, so that's understood. But if you look at especially the Latinx population in Boston, they are behind the other populations. What do you see the problem being there?
Yeah, I mean, a lot of it has to do with making sure that we create not only the access, but that we're doing the legwork to get folks in, right? You can't just set up a clinic. You gotta make sure that people are getting relationships built within the community to do that, right? So for example, yesterday, we were in Via Victoria in the South End in partnership with EVA, a clinic we brought to the neighborhood. EVA did a bunch of outreach, able to vaccinate almost 200 folks there. Did the same thing with a predominantly immigrant Spanish-speaking church in East Boston Friday of last week. Same thing, parishioners being organized by the faith-based leaders there to get them to turn out at that clinic. So we have to make sure that the outreach happens. We have to make sure that folks have the knowledge and information and that it's linguistically and culturally competent to get folks in. I do think in the Latinx community, it is the youngest community in the city of Boston. And since most of the eligibility has been by age, we are eager to see that come down for all folks so we can get the younger population in line so they can get vaccinated as well. I think that's going to be one of the issues that we're going to see, and hopefully we see some of those numbers improve, specifically in the Latino community.
One thing that normally happens with the vaccination is that somebody asks you to show an ID. Is that an issue for immigrants?
Yeah, absolutely. I mean, I think for on the city end, if we run a clinic ourselves and then we're facilitating it, we really do not want to ask for an ID. The state system does require it be asked, but you don't have to have an ID. And that's true at a state vaccination clinic. It's true at any clinic in the city of Boston. You don't have to have an ID to get vaccinated. But you might get asked for that just to clarify information, make sure your information is accurate in the system. But if you don't have it, you don't need it. But you're absolutely right, Chris, that it's really important that people understand immigration status doesn't matter, whether you have an ID doesn't matter. The goal is to get everyone vaccinated. There's no cost to you as the individual. And we really want to make sure there's no barriers to making sure that as many people in our neighborhoods get vaccinated as possible.
I want to ask you about the tone of the city's outreach campaign here, because that is based on what you think the obstacles are that you're trying to surmount. That is there resistance out there, or is there some other reason why people might be a little more reluctant? What's the city's strategy on that?
So, we've seen a lot of campaigns. I mean, the state has a campaign about trust the facts. That's more now, thinking about the knowledge and the information. We have other people connecting to stories, seeing people like you get vaccinated, and that's important as well. The city wanted to lean into to hope. We wanted to lean into the fact that for so many of us, it's been a very challenging year, and we haven't been able to do the things we love, see all the friends and family that we love, and so we really wanted to lean in that getting a vaccine is a step closer to having a more hopeful community. It's a step closer to being able to do the things you want to do. So we think it's your way to contribute to this effort, but it's also your way that all of us are looking. And we're hoping for a better tomorrow post-COVID as we try to recover from what's been, a very, very challenging time, if not the most challenging time ever in our history.
Even now, some people might think that a figure like 42% at least partially vaccinated sounds pretty encouraging, so they might be thinking, well, what's the big deal? I mean, how many people do you really have to vaccinate to make this work?
Right. Yeah, absolutely. I mean, for us, we want to try to get up to, 75% of folks vaccinated, fully vaccinated, which is important, right? I think right now we're under 24% fully vaccinated. So that means, 3/4 of our population, not there yet, don't have that protection built up from the vaccine. So it's really important that we do that, right? If we want to get back to those things, we need as many people to get vaccinated as possible, especially given the fact that we do still have cases coming in, averaging about 200 cases a day right now still. And so we absolutely know COVID's still out there and we're going to be living with it. But we want to live with it with the most protection we can in the community, which is why we need to get a high number of folks vaccinated.
I guess one other concern is that if you leave too many people unprotected, that leaves more room for more variants, doesn't it?
Yeah, absolutely. Variants can't, the virus can't, change and adapt if it has nowhere to change and adapt to. So the more people that are unprotected, the more it spreads and the more it's able to morph to try to, win this war against the vaccine, if you will. So for us, the vaccine helps us to be able to not only tamper it down and slow down the spread, but it really does help us to be able to get to the other side of this. So it's important that we all do it. And we've been focused on those most severely impacted, which is why we've seen severe hospitalization go down. We've seen deaths go down, really important. But now we need everyone to do their part and to be able to get vaccinated when it's their turn, which for next week is everybody. So we're excited for that moment.
Chief, with all the focus on vaccination, we're hearing less talk about testing these days, but I guess there's still a need for that, isn't there?
There is. We want to make sure that people are doing all the things that have gotten us this far, right? Not only getting tested, which is critically important, but wearing a face covering, socially distancing, especially from those who haven't been vaccinated, which is the majority of folks in our city still. So we need everyone to still do those things a little bit longer. And some of that's going to be around for a while, but if you feel like you've been exposed, if you have symptoms, if you're out sort of trying to enjoy life and you have not been vaccinated, you absolutely should get tested. We have seen a little bit of dip in that in the city. So we definitely want to make sure people are still getting tested if they need to.
And finally, if people want some more information about testing or getting vaccinated, any place you suggest they go to or call perhaps?
Yeah, people can definitely go to boston.gov. There's information on testing sites. There's information on our vaccine clinics that's updated regularly. We have 26 different places across the city right now from clinics that you can go to. And there you can learn information about how to register and how to make sure that when it's your turn, you're ready to get it.
Well, thank you very much for taking the time to be with us.
I appreciate it. Thanks so much, Chris.
That was Boston's Chief of Health and Human Services, Marty Martinez.